In this first video, we're going to look at how to define the anatomic landmarks in three-dimensional planning for shoulder arthroplasty. When we first start looking at the axial, sagittal, and coronal images that were originally obtained from the CT scanner, we see that these look very out of plane, and here we can see that the coronal and sagittal images are not in the plane of the scapula or perpendicular to it. But when we reformat this into the plane of the scapula, we see that now the axial, coronal, and sagittal images are in the plane of the scapular body and perpendicular and orthogonal to it. It's critical to understand this point whether we're planning on two-dimensional or three-dimensional images. Now we begin defining our anatomic landmarks, and this includes the inferior angle of the scapula, the trigonum scapula, which is the confluence of the scapular spine and the medial border of the scapula, and the center of the glenoid face. Peripheral osteophytes will skew the interpretation of what defines the center of the glenoid, and in this case we can see that there's a large peripheral posterior osteophyte. At this point we define the plane of the glenoid face by using 3 points, and again it's important to exclude the osteophytes anteriorly and posteriorly, as anterior osteophytes will give a falsely increased sense of retroversion and posterior osteophytes will give a falsely decreased sense of retroversion. In this case we can see that our retroversion is 25 degrees and we have an inclination of 3 degrees. And here we cross-reference our two-dimensional imaging to ensure that the defined plane of the glenoid is accurate.